Good morning. It is officially the first day of my second year of dental hygiene school. This is the summer semester. It'll be 8 weeks. Today's Monday. I have a total of 3 classes today. It'll be from 8 to 5. First class is oral health management. Let's see. Second class is dental hygiene principles 3. And then I have pharmacology at the end from 1 to 5. It's a long one. Pero I'm heading to school now so I can get studying for these classes because I have quizzes on all of them except for one. So I'll see you guys in la tarde because tomorrow I have to take my skill assessment on sickles, area specific, and universals. It'll be on each other, so that'll be our first skill assessment of the summer semester. So I'll be practicing for that in the afternoon. So I'll see you guys al rato. Good morning. So it is Tuesday. Yesterday was Monday. It went pretty well. I did pretty good on my quizzes. I only ended up having 2. I was there from 8 to 5, but now today it's about to be 7 o'clock. I need to be in clinic to do my skill assessment on the area specifics, sickles, and universals. We'll see how it goes. I was practicing all day yesterday after I got out of class, and I was struggling to get to 70 to 80, but we'll see how it goes. Hopefully I can pass. I mean, I passed it last semester, so I should be getting better. I shouldn't be getting worse, but we'll see how it goes. I'll let you know how it goes once I get out of clinic today. Okay, so I'm heading home for the day. My skill assessment that I did, it was on area specific curettes, sickles, and universal curettes. It went pretty well. I passed. I got a good grade. I was a little worried, but everything turned out okay. So I'm off to a good start with the semester. I've taken 2 quizzes. One was 100%. The other one was a B, which is pretty good. But tomorrow I have what we call screening duty. So it's like the patients that call the school that want to make an appointment. We have to screen them to see like how they would qualify in terms of how much calculus or how involved they are. So I'll have that in the morning. It'll be my first time. We'll see how it goes. And then I also will have another patient in the afternoon. This is the first time we're seeing patients back to back. So I'll have somebody coming in the afternoon. My goal is to try to get through all the assessment phase done. It's quite a bit. I do need to take a full FMX. So many things to do, but it should be a little bit more smoother in the sense that we don't need to get as many instructor checks along the way. For example, we would do, like this semester, we're completing the entire assessment phase and then getting the instructor check, whereas before we would have like 2 or 3. So that'll be my goal for tomorrow. So I have to come in here early and see how it goes. But I'm just gonna head home, practice a little bit my exploring and my probing, because that's what I'll have to do tomorrow for both patients. And then I'm also going to make like a list of everything that I have to do, and then I'll pull that up on the computer as I'm in clinic, and then I'll kind of I want to write down exactly how long it takes me to do each thing, so that way when I go home I can reflect like, okay, it took me 30 minutes to do this, 40 minutes to do this, or whatever, and I can see like what is taking me the longest during the appointments, and I can try to focus on trying to cut down on the time. So that'll be my plan for tomorrow. I'm gonna head home, and I'm gonna head home, and I'll see you guys tomorrow. Good morning. It is Wednesday. It's the first day back in clinic. So this morning I'll be doing my screening duty for my patient, and then I am having my first patient of my own in the afternoon. We'll see how it goes. I'll try to see if I can get all the assessment data done in the first appointment, but we'll see because I have to take x-rays. I don't know how long that will take. Okay, I will see you guys once I get out of clinic. Good morning. It is officially week 2. So this morning we're going to school early. Class is starting at 7:30 instead of 8. And then we had a quiz that we were supposed to take before coming to class, like online. It was like through the lockdown browser, so it was like recorded, I guess. And I ended up taking that like at 9 p.m. because I didn't want to wake up early and take it. But I have material, and then we're taking a test for it right after. So we'll see how that goes. We, as like part of homework assignment, we have to do a study guide for weeks 1 and weeks 2 for the test that we're taking today, but I don't know how much of the information I retained. I think I spent more time doing the study guide than actually studying it, but we'll see how it goes. I'll let you know once I get out of class. You guys see those conejitos? Hang on. You see them? New. They had babies. Okay, you know what? Let me just say something. I was stressing because ahorita los vamos a pasar. Okay, we'll go this way. I was stressing because I didn't have enough time to study for these other classes, but then I'm like looking at those bunnies over there, and I'm like, si ellos no están preocupadas for the tomorrow or for the today, why should I be? You know, todo en las manos de Dios. I did what I could. I studied what I could. Todo va a salir bien. So I'm just gonna go in, study for a little bit, and then hope for the best. So I'll see you guys, for real this time, ya cuando salga de la clase. Bye. It is Wednesday, week 2. So I'm here at school early. Today I have a full day of clinic. So I'll have a clinic session in the morning and then one in the afternoon. So my first patient in the morning is a patient from the school, and then in the afternoon I have my mom coming in. I want to try to finish her appointment. I got her started yesterday. Everything went pretty well, but we'll see how it goes. So I'll see you guys once I get out of clinic. I'm on my way home. I just got out of clinic. It's like 7 p.m. now. 12 hours at school. But I had 2 patients today. The first one was a patient that has been here at the school before. So she was coming in for like a recall appointment. And then the second was my mom that I was trying to go ahead and finish. I didn't get to quite finish her. I just have to do 1 quadrant left, and then I'll finish her next week, Tuesday, for sure. But I'm learning a lot. My grade is taking a hit, but like in a good way. Like the stuff that I'm being marked down for is really like opening my eyes to see like what I need to improve on. But I know I can get the grade back up. I just have to keep like reapplying what I'm learning so that I can keep improving my grade. But right now I'm gonna head home. My back is on fire. I have a habit of like leaning forward to like see into the mouth, and it's making my back like hurt quite a bit. But I'm just gonna head home. I might just relax for the rest of the day and then start the homework for the rest of the week tomorrow. But I also want to go ahead and practice on my Dentec, so I'll try to show you kind of what I've been learning in clinic and how I've been applying it. But I'll go ahead and see you guys later. Bye. It is the 3rd week. It's Monday. I have a test today for pharmacology, and I have a quiz on like advanced instruments this morning. It's 7. I got here like an hour before class starts so I can review a little bit. I've been reviewing for the last couple of days, so hopefully everything will go well. I was also stressing a little bit about patients, so I need to have a 2 this summer, and I'm running out of appointments to try to find somebody and for them to fit the schedule I have left. But I'm not gonna stress. It's all in God's hands. Everything will work out, hopefully. But I'll see you guys once I get out of class, and I'll let you know how it went with the exam and the quiz. Good morning. It is Tuesday. Yesterday I had my first pharmacology exam. I did pretty well. I only got 1 question wrong. And then I did take that quiz on the advanced instruments. That one went pretty well too. Got 100%. I ended up waking up at 4 a.m. to study for those, and it paid off because I ended up doing pretty good. But today's now Tuesday. I have clinic this morning, and I'll have radiology in the afternoon. But I'm going to try to finish up my patient today and try to do the polishing skill assessment as well. So this semester we have to do 2 exploring skill assessment cross arch, so like that or like that. And then I also have to do like a sterilization skill assessment as well. So I'm gonna save that for when I have another clinic duty. So that I think that'll be like the best time for me. But if I could try to get it done today, I'll try it. We'll see. Also, I have been pretty stressed trying to find a patient that qualifies as a 2 and sub, meaning that they have 12 to 20 teeth with calculus underneath the gums. This is like the hardest patient to try to find, but you know, I'm just gonna leave it in God's hands. Like, God sees that I'm trying to find these patients, but we'll see how it goes. I also don't have a patient for tomorrow morning, just in the afternoon. We do get like 2 days where it's like an excuse, like if we don't have a patient in the chair, but I'm trying to avoid using those as much as possible so I don't miss out on experience. And then there's no guarantee that a patient in the future might cancel, so I'll try to see if I can find somebody. I'll let you know how it goes, but I'll see you guys once I get back out of clinic. Good morning. It is Wednesday. No, it's Monday, week 4. So I'm here at school early. Class isn't gonna start until 10:30 today because one of our classes got moved to Thursday. But I can't remember if I recorded, but clinic's been going pretty good. I managed to get my grade back up to passing in one of my patients. I just have to finish up her cleaning and then I'll be all set. So I have 2 quizzes today. One of them is on like dentinal hypersensitivity, and then the other is gonna be like on opioids, non-opioids, analgesics, and things like that. So I'll see you guys once I get out. Good morning. So it is Wednesday. Yesterday we didn't have any school, but I still ended up coming to school just to study a little bit and get some things done on the computer in regards to my patients. But today I'm going to finish up another patient in the morning, and then I'm going to start my 2 this afternoon. Hopefully all goes well. I want to try to get all the assessment phase done, so we'll see how that goes. Then I do have a quiz that I have to do. I think today after clinic I'm going to go ahead and do it, and it's on for my special needs class. So it'll be like Addison's disease, Cushing's disease, diabetes, thyroid disorders. It's also going to be on cancers. So that'll be, I haven't really studied too much for it. I haven't had the time and I'm super tired, but we'll see how that goes. And then I'll have class. Then I'm coming in tomorrow, Thursday, to screen some patients to see if we can find some perio patients, because that's what we're going to need until the fall. And it'll be easier if you have somebody already going into the fall rather than trying to find somebody the first 2 weeks of fall, which is super stressful, and I don't want to do that. So hopefully we'll find somebody. And then we're going to have the special needs class Thursday afternoon after clinic around 7:30 p.m. We didn't have that class. Usually we have it first thing Monday morning, but we didn't have it this time. The teacher had to do something with like the first years, but hopefully all goes well. I'll see you guys once I get out of clinic. Good morning. It is week 5, I believe. We're officially halfway through the semester. Today I have a quiz for 151, which is like oral health strategies kind of class, I think. And then I have a quiz for special needs. Then I have a test, second test for pharmacology, so we'll see how that goes. It's a little early. We're starting class today at 7:30 instead of 8, which is works out pretty good because then we'll have like a bigger gap between special needs and 151, so it'll give me more time to study for that quiz. But I'm gonna go ahead and get started with some studying. Been up since like 5 a.m. but we'll see how much I can get done. Then tomorrow I have clinic. I gotta see if this patient is gonna confirm their appointment. I don't know, we'll see. And then we switched instructors, so we'll have different instructors for the second half of the semester. We'll see how that goes, but I'll see you guys once I get out. Morning. It is Tuesday again. So I have clinic this morning. Just in the morning, and then in the afternoon I'll have radiology. And I'm going to get my x-rays graded that I took. They did not come out good at all, but it's okay. But this morning, well, yesterday afternoon was quite the struggle to try and get in contact with my patient, but that's okay. I don't know if he'll come, but I did manage to find a backup. But what I would suggest to you guys who are thinking about going into dental hygiene school, or who are in dental hygiene school, just make sure you always have a backup just in case somebody doesn't show up. That way you can still see a patient. I'm not sure how the other school does it, but in this school, if you don't have somebody to fill in your seat, it goes against your grade. So hopefully this patient shows up. If not, I'll bring in my backup. But I will see you guys once I get out of class. It is Wednesday. Gonna be in clinic all day. Yesterday went okay. My original patient didn't come in, but luckily my backup did. I didn't get as far as I wanted to with the assessment phase, but that's okay. I'm just grateful I had somebody in the chair. But now I'm going to go ahead and I'm gonna have 2 patients this morning, 1 in the afternoon and 1 in the morning. Hopefully all goes well. All right, happy 4th. We're on our way to see los cohetes. She's scared. Pues a ver como, I think we're running a little late to the thing, but I think it should start around 10. It's like 9 something. But let me clue you in on how it's been going this week. So with clinic, I started debriding my 2 patient. Ooh. My 2 patient, it went pretty good. Had a lot of learning experience. Now the only worry I have now is that I'll complete all my requirements by the end of the semester. But we'll see how it goes. But I've been doing homework all day. Loud. I've been doing homework all day and studying, so this will be my little break to go and watch the fireworks show. But I'll see you guys once I get there. It is Monday. The weekend, a little hectic. I have a test on like 8 modules or something for special needs. It's a lot of information, a lot to remember, so many different signs and symptoms for the different conditions. But we'll see how the test goes, and then we have a quiz, 2 other quizzes. Didn't study a whole bunch for those because I was focusing more on the test. So many assignments to do as well, but we'll see how it goes. And then tomorrow we don't have any clinic. I think we're gonna be practicing like wheelchair transfers and something else I think we're gonna be doing in the lab. But I'll see you guys once I get out of class. I got here a little early so that I could review for this test and then look something up for that assignment that I need to turn in at 8. It's like 6:30 right now, but I'm sure I'll get it done. So I'll see you guys later. Good morning. It is Tuesday. Yesterday, quizzes and tests did not go good, but that's okay. And I still have a chance to bring the grade back up a little bit, but we'll see. Today we're going into the sim lab, so today we're going to be practicing the furcation probe, and we're going to be practicing air polishing on each other. So I got to school a little bit early so I can review the PowerPoint for air polishing, and then I'll go in and start setting up. So I'll see you guys afterwards. Morning. It is Wednesday. So yesterday was pretty fun with doing the air polishing on each other. So we're gonna be having a skill assessment next semester, so we need to find a patient with a lot of staining to be able to do that. We'll see how that goes. And then we also practice in the sim lab with the furcation probe, so now we have like a better idea on how to use it. What else did we do? And we also went over in the classroom just like the indications, contraindications for air polishing, which was really nice. But now this morning I have clinic all day. First half I'm going to be screening again. I have screening duty. And then the second half I have my own patient coming in. It'll be my 2 and sub patient. So hopefully I can get pretty far. That's the plan, but we'll see. But I'll see you guys once I get out of clinic. Hey guys, I just wanted to quickly show you what we've been learning. So this here is the neighbor's probe. These lines go by 3, 6, 9, 12, which is pretty good. So the way that we use these, so how we've been taught was, I'm gonna peel this back. So there's gonna be a furcation entrance, which is where the root's trunk is. So essentially when we're checking these, we're gonna go, for example, on the mandibular teeth, we just go like this, like this, like this. And how it was explained to me is if it's a class 1 furcation, the neighbor's probe is going to be stuck like this and can't go back and forth. And if you pull up, it should be able to come out. However, if it's a class 2, it's going to get stuck in between. And if you try to pull it up, it's going to get stuck. A class 3 is that the instrument is able to go through this side and come out through the other side. But the gum is still covering everything, so you can't clinically see it. But with a class 4, the gums have receded to the point where you can see the furcation entrance and the probe can go through and through. Now for the mandibular teeth, there's just 2 roots, mesial and distal, but the maxillary teeth up here have a total of 3 roots. There's 1 on the palatal side, and then we've got 2 in the mesial and the distal. So that's what we've been learning with the neighbor's probe. I'm gonna show you what we've been learning about the new advanced fulcrums. I pulled the gums back so I can show you a little bit, but normally how we've been taught was to fulcrum like 2 to 3 teeth away, and then we would just wrist rock back and forth while maintaining that 70 to 80 degrees. But now we've been taught, one of the advanced fulcrums that I was taught was to place my hand on the patient's cheek like this, palm up. These are the maxillary teeth, so palm up. And just slowly make their way around. Morning. It is Thursday. Yesterday clinic went pretty well. I did a lot better with my patient, but the clinic in the morning ended up being canceled because there was like a gas leak or something. Something was leaking, and so we canceled all the appointments in the morning, but we were able to see patients in the afternoon. Worked out quite nicely for me because I was on screening duty, so I didn't lose any appointments with my patients that I'm currently seeing. But now we have but now this morning I'm going in to do 2 screenings, hopefully 2 screenings. One of them canceled just now in the morning, but we'll try to see if we can still fill in the chair. But for this afternoon, we'll definitely have somebody. And then I have to get going on studying with all these. We have another test for pharmacology, and it's a lot, but we'll see how it goes. But I'll see you guys afterwards. So morning. Oh my god, it's so bright. I am at school. I have my 3rd exam for pharmacology today. Then I have a quiz on the ultrasonics and sonics. So I have to take that quiz first, and then it's the test. So I've been studying all day yesterday. Woke up really early today, like around 4:30 to study. It's currently like almost 7. Class starts at 8, so we'll see how it goes. I'll let you guys know how it goes. Morning. It is Tuesday. So this morning we don't have any patients today, but we're going to be practicing wheelchair transfer. And we're going to be doing the 1-man and 2-man. So 1-man being you transfer the patient on your own. 2-man is when you use 2 people to transfer the patient. Then I think afterwards we're going to be working with the Cavitron, where we've been using the slimline so far, but I think we're going to start using different inserts that are more so for heavier calculus. So we'll see how that goes. But I'll see you guys once I get out of clinic. Oh, and then before I let you go, yesterday quiz went well, 10 out of 10. But then the exam I took for radiology, I think I got an 85, which is not too bad. Now we just have finals, which is pretty exciting. So we'll see how that goes too. All right, see you guys once I get out of class. All right, just wanted to bring you with me in class. So this is what we're learning today. Okay, so these are going to be the left and right inserts. This one over here is going to the right, so this is the right insert. It's going to have an R on it so that you know it's the one curving to the right. This blue one is the one curving to the left. Now, to know which one we're supposed to use where, you're going to look at the terminal shank. If it is parallel going up and down the tooth, it is the wrong one. So if we take a look at the other insert here, do you see how it's wrapping around the tooth? That's what we want. It's similar to the neighbor's probe. So when we use these, for example, in the distal, we can just go up and down like a probing motion, and we could also go horizontally and move it back and forth. But we do want to start from the top and then slowly make our way down to the bottom. Okay, so not only is this insert good for that tooth, but it's also going to be the right working end for the entire buccal all the way up to tooth number 25. However, it's not the case for all surfaces of the teeth, so that one's just good from the buccal all the way up to 25. And if we want to do the linguals, we're going to have to switch to the other insert, because if we take a look what the insert we originally had, the shank is going to be parallel, which is not what we want. We want it to kind of wrap around the tooth. So if we pick up the other one and take a look for the lingual, once we place it, you see how the terminal shank's wrapping around the tooth? That's the right working end for the lingual surfaces, and it's going to go all the way from tooth 31 to tooth 25. And that insert on the other side is not the right one because it's parallel. It has to wrap around the tooth, so that's going to be good all the way up to tooth number 24. Good morning, it is Wednesday, so today I have clinic all day. I do have one patient that's going to be staying the whole day for me, so it'll be from 8 to 11:30 and then from 1:30 to 5. My goal is to finish this patient. I have to finish this patient. I don't have any other appointments for the rest of the semester. If I don't finish this patient, not good. But with the Lord, everything's possible. I'm going to do it. I don't know how, but with Jesus, I can. But, okay, I will... Oh, yesterday when we did the wheelchair transfer, that was really fun. I got transferred from the wheelchair to the dental chair, then from the dental chair back to the wheelchair, which was pretty fun. And then we got to do practice using the triple bend and the piezo. And we got to practice the triple bend using the wax, a candle, and we had to remove like the white part of the candle. You know those candles that have like little white swirls going down? Well, we had to remove that without trying to gouge the candle. It's pretty gouged. I'll show you once I get out of the clinic, because I left it in the school, how bad it looks. But I got better towards the end. But I'll see you guys once I get out of the clinic. Here is said candle that I mentioned earlier. As you can see, it is very gouged. That's okay. It's those swirly candles that had the little white swirl going all the way around. But I did get better towards the end. I mean, it was my first time using the slimline, so it was a learning experience. Everyone's candle looked like this except for the dentist that we had in the class, but she was a total pro. But there's like a good good amount of sections where I did get the whole little piece off in one go, but overall it's looking a little rough. I promise I will get better. This is just the beginning. We're finding ranitas. Hello, good morning. Today is Monday. Today is the day of the finals. We have 4 final exams today. For one class we have 2. They call it like an OSCE. It's supposed to be like a station exam. So they'll have like different instruments at different stations, and then we'll answer questions based off of that. So it'll be more like along the lines of like, oh, this instrument is used where? What's wrong with this? Like that kind of thing. And then we'll have the written. We'll have a little break, take the second exam, which will be for special needs. And then afterwards we'll have another break and then take the exam for pharmacology, which I'm a little worried because I didn't get to review like 4 PowerPoints just because it's so much information. I've been studying all day, literally for the last couple of days, but I came out here like 2 hours before the exam starts. It starts at 8. It's 6 o'clock on the dot, but I'm gonna sit out here for a little bit and review, and then I'll head in to take the exam. And then tomorrow, we'll have clinic in the morning. It'll be our last Tuesday clinic, and then we're gonna have in the afternoon an exam, final exam for radiology. It's gonna be 8 questions, 1 written, and then we'll see how that goes. It's like 10% of the grade. So, and then Wednesday we'll have clinic all day, and that's it. And then hopefully I pass everything, and then I get to move on. But I know I will. Faith in Jesus, all I can say. So let me get back to studying, and then I'll see you guys al ratito. Good morning. So it is Tuesday, day after the finals. I don't know how it went. I think I passed for sure 2 of my classes, but one of them, the exam was really hard. I'm a little nervous, but all in God's hands. We'll see how it goes. And now today it is Tuesday, so I'm seeing my 2 and sub patient. So I want to try to get as far as possible so that I can finish him tomorrow. And then tomorrow I'll be finishing one of my other patients as well. So that way I'll complete my 5 patient requirements. But we'll see how it goes today. Hopefully all goes well. But I will see you guys later. Good morning. It is officially the last day of summer, of the summer semester. Today I'm seeing my last 2 patient requirements. The first one, I should be able to get both of them done today. The first one is like considered my 0. I have 1 quad left to debride, so that will be pretty fun. And same thing with my last patient, I only have 1 quadrant left to debride. Hopefully all goes well and I get all the calculus off. Pretty exciting. So I will see you guys after I get out of clinic, and I'll let you know how it goes. So it is a couple of days before the new semester starts. Just to give you an update, I did pass all of my classes, pretty good, passed clinic. But now I am getting ready for this coming semester. It's gonna only get harder from here. I've yet to find my perio patient, but we'll see how it goes. So we do have an exam for perio on everything we've learned so far. So that's what I'm preparing for now. That's what I'm preparing for now here at the library. And I still need to practice on my dentec. I took all my stuff home with the intention of practicing within these 3 weeks. Did I do it? No. What day is it? Friday. When does school start? Monday. So here we are. I'm gonna get it done today. But thank you so much for watching my journey thus far. I didn't get a chance to record a lot in class because it was just all lecture, and it was all on Monday, and I can't really record in clinic because HIPAA, the patients are there. But I'll try and see if I can bring you guys along during SimLab. We will have SimLab this coming semester. That's when we go and practice on like the little Dexters. We'll be practicing on like the newer instruments. But thank you for watching my journey so far. Hope you guys join me for the next one. Bye.